Now there's a way to manage your patient's core temperature from the inside out that requires little or no nursing staff intervention. The advanced intravascular approach from Zoll makes it possible to rapidly and precisely control patient temperature during warming as well as cooling procedures. How is this accomplished? Using a Zoll ThermoGuard XP system, temperature-controlled saline is circulated in a closed-loop fashion within balloons located on the central venous catheter. The ThermoGuard system adjusts the temperature of the saline circulating within the balloons based upon the actual temperature of the patient. The patient's core temperature is then changed as the blood flows across the balloons on the catheter. No saline is infused into the patient, nor is any fluid removed from the patient. Now, since you're probably well acquainted with the use of standard central venous lines, we'll concentrate on techniques and features that are unique to the Zoll heat exchange catheters. But first, before using any of our catheters, please read the instructions for use to identify the common risks associated with central line catheters. Zoll offers several heat exchange catheters, all of which are sterile and designed for single use. The Cool line is a double balloon catheter designed for placement in the jugular, subclavian, or femoral veins and has a maximum use period of 7 days. The Icy is a triple balloon catheter, while the Quattro is a 4-balloon catheter. The Icy and Quattro catheters can be inserted into the femoral vein and reside within the inferior vena cava. Both of these catheters have a maximum use period of 4 days. Once the maximum use period has expired, simply replace the catheter over the wire with a fresh new one. All of the Zoll catheters are MRI safe and latex free. They feature an inflow and outflow saline port and up to 3 infusion lumens. As with standard central venous catheters, these infusion lines can be used for fluid management, CVP measurement, blood sampling, and medication delivery. You'll find that Zoll has a number of components required for percutaneous insertion in every catheter kit. Check the instructions for use for a complete listing. Key items are a guide wire, a vessel dilator, and a detachable suture tab and clip. Preparing the catheter. To begin, please check the expiration date on the catheter package. Then, open the tray and remove the Zoll heat exchange catheter. Keeping the balloon cover in place, remove the 2 caps from the saline inflow and outflow lure hubs. Slowly inject sterile saline through the inflow lure until it begins to exit the outflow lure. It's important to always remove the outflow cap before injecting any saline. Placing the catheter. Employing the Seldinger technique, carefully insert the Zoll heat exchange catheter. Use the included vessel dilator to appropriately enlarge the site prior to insertion. Note that there are radiopaque markers to clearly indicate the proximal and distal limits of the catheter balloons. Use an X-ray device to ensure that the balloons are residing completely within the vessel. To avoid reduction in heat exchange performance, use only the Zoll suture tab and clip provided in the kit. Do not suture directly around the outside of the catheter shaft, and be careful not to clamp or occlude the saline inflow or outflow lines during patient treatment. You are now ready to connect the catheter to the Zoll startup kit tubing and begin patient treatment. Removing the catheter. To remove the catheter, first place the system in standby mode. Then, disconnect the startup kit tubing from the catheter. Do not cap or cross-connect the catheter saline inflow and outflow ports. Both the inflow and outflow saline lumens must be open so that the saline can freely flow out of the balloons during the extraction procedure. This is important because the balloons must be able to fully deflate in order to facilitate easy removal from the vessel. If you feel any resistance during removal, do not move the catheter. Check that both the inflow and outflow lumens are uncapped. Attempt to remove the catheter again. If resistance is still encountered, perform an X-ray to determine the cause of the resistance. Zoll thanks you for taking the time to familiarize yourself with the proper use of our heat exchange catheters. For 24-hour technical support within the United States, please call 877-225-7487, extension 3. Outside the United States, contact your local distributor.